My name is Melissa, I'm one of the vets here, and today we're talking about poisonings, or intoxications, whichever way you want to call it. So we're going to talk a bit about rat bait and then touch on some snail bait issues as well. So they're not an uncommon thing that we see in dogs. Unfortunately, these products tend to be quite attractive to dogs. So things like rat bait is probably more common at the moment than the snail bait because people aren't putting as much snail pellets out, but certainly at different times of the year we see problems with the snail and slug baits as well. So first of all, we're going to talk about rat bait. If you have any questions or anything, don't hesitate, send us a message. Cal's behind the cameras today. He'll let us know if a message comes through. So if you have any questions at all, don't hesitate to interrupt. Very happy to answer questions. So rat bait, a lot of people get very worried about this. It is a nasty chemical, unfortunately. It comes in different forms. So you see pellets, you see the big chunky bricks as well. And unfortunately, these things are made to be attractive to rats and mice, obviously, but these products are often wheat-based or grain-based of some sort, and that makes it also attractive to dogs and cats. So when you put it out in your yard or in the house, the problem is that rats and mice can actually move the product around. So you might think you've hidden it behind a piece of furniture or inside a cupboard or something, but unfortunately rats can pick up and carry things and it can end up somewhere else. The other situation where we have unknown toxins around is if people move into new houses or rent a property or move into an old house and they've got a garage that's got things in it, and they don't realise that there's actually stuff there that you didn't know was there. So always check in those areas first. If you know that your pet has had something that they shouldn't have, whether it's a rat bait, a snail bait or any other form of toxin, the most important thing is to get onto your vet as fast as possible, because with all of these toxins, all of these chemicals, the best thing we can do actually is to make them vomit in most circumstances, unless it's a really toxic product. But certainly with rat bait and snail bait, the quicker you get them to the vet clinic and the quicker we can make them vomit and empty out their stomachs, the less toxin they're going to absorb, the less chance of them getting sick from it. So when it comes to rat bait, the interesting thing that a lot of people don't realise is you won't see signs straight away. So these are long-acting chemicals, long-acting toxins. And so these chemicals can actually have an effect on your pet's system for up to 6 weeks after they've ingested it. So it's a long period of time. And what rat bait does, most of them affect their ability to clot their blood. So what happens when we cut ourselves or your dogs cut yourselves with blood, it doesn't continue to bleed, because what happens is you see it forms a little clot on the surface of where you're bleeding from. And what that is the body's natural protection to stop themselves from bleeding. And that's anywhere in the body. So if a blood vessel gets damaged, it causes these other things to happen that forms a clot and the blood stops bleeding out of the blood vessel. And what happens when these animals ingest the rat bait or the rat toxin is that they actually it stops that clotting process from happening. So animals actually with symptoms from rat bait can actually be anything. It can be that they can bleed from any part of their bodies, any of their blood vessels. So we can get dogs that have blood coming through their wee, we have blood coming out of their intestines. So you'll see black poop if they're bleeding in their intestines. They unfortunately can also bleed in their brains, so we can have things like strokes, or they can bleed in their lungs or into their bellies. And so these symptoms are very, very varied. So if you don't know that you've got rat bait or mouse bait around, then sometimes it can actually be quite a difficult thing to diagnose down the track once you've got a bleeding issue. But if you know your pet has eaten some of this, just because it takes a long time to develop doesn't mean you don't get them to the vet straight away, because the quicker we make them vomit, the better it is. We get less in their system, less toxin, less poison. And then with these products, most of these we actually have not an antidote, but we have a treatment available. So they go on to vitamin K. Vitamin K is not the cheapest thing on the market, so it's again something better to avoid. But these animals go on to treatment for up to 6 weeks. Most of the rat bait and rat bait and mouse bait that are on the market these days are the long-acting type. Warfarin's are short-acting, it only goes for a week. But there's very few products now on the market that are actually warfarin based. Most of them are the long-acting ones, and unfortunately, even if it says that it's pet friendly or has a bittering agent, we see dogs, particularly the dogs that eat anything like the Labradors and so forth, the beagles, speaking as a beagle owner myself, these guys will still eat it. So just be very, very, very careful. Don't have it out and about. Make sure if you see your pet eat them, most of them are coloured, so when they vomit, they're bright blue or bright purple. When they vomit, we can actually see it, or you can actually see the colour coming out in the poop as well. So these have dyes in them that go through their systems. So you'll actually see the colours, the bright blue or the bright purple coming through. So if you have rat bait around, make sure it's somewhere that's really, really safe, that the mice and the rats can't drag it to somewhere where your dogs can get it. If you do think your dog's eaten it, then get them to the vets as quickly as you can. Even within a couple of hours, we can sometimes make them vomit at least some of it out of their system. If they've taken in a lot and we know we haven't been able to get them to vomit, we can give them an anaesthetic and flush out their stomachs and flush out their back ends as well. If they've eaten anything at all, we also can do, if you're unsure if they've eaten it, or we make them vomit and we think we've got it all out, we can do blood testing for clotting profiles, and we do them sort of 48 to 72 hours after ingestion, and if that's all clear, then they don't need to be on prevention. Once we've treated them for the 6 weeks or 4 to 6 week period, depending on what type they've eaten, we then do a blood test a few days later to make sure that their clotting is back to normal and they're able to clot themselves. We actually have in-house clotting testing, so we can actually do that test in-house at our practice. Your own vets might need to send it away, or they may be able to do it in-house as well. So that's the rat bait thing. The other side of the other part of the most common toxin we get is dogs eating is the snail and the slug baits. Now Matt, I know, has done a very good video attached to our Facebook that you can get a lot more information. Whoops, we just kicked the it's an earthquake. No, it's all right, Cal just kicked the stand. So slug and snail bait are very different from the rat poisons because they actually cause almost immediate symptoms. It's an awful condition to see. These dogs will actually, we're going really crazy now. These dogs will actually cause seizures. So these chemicals actually cause seizuring, muscle twitching and so forth. Dogs will vomit and they'll often have symptoms within a few hours or even a few minutes of ingestion. They love these things. So most of them, the green, blue, Base Sol and Defender are the most common ones. They have the chemicals metaldehyde and methadone. Methadone has a partial antagonist or a partial treatment, but metaldehyde has no treatment available except that we have to actually anaesthetize these dogs if they're really, really bad. We have to stomach flush them, we have to back end flush them. It's a really, really awful situation to be in. I once, when I was a student, will never ever forget 3 Labradors that ate about 3 packets between them. An absolutely horrendous situation. They're made out of often wheat and barley, and they have molasses and honey in them to make them taste good to the snails and slugs, and unfortunately dogs like them. There is another product of the snail and slug on the market that is an iron EDTA based product, and they say it's pet friendly. However, if your dog still eats enough of it, they can get very ill as well. So with all of these things, don't have it in your yard if you can avoid it. If you are going to put it in your yard, have it in a system that your dogs cannot get attached or cannot get it out. So better to not have it at all. If you do have it in your yard, you're best off actually digging it out, getting rid of the soil that it's within, because they can last a long time, these chemicals, or trying to break it up and break it down into the ground so that you can water it in so it's not access to your dogs. But as I said, there's much more information about the snail and slug bait from Matt's video that's on our Facebook page. So I hope that has been helpful. Most take-home message, obviously don't have these products if you can avoid having them in your house. If you do have them somewhere in your yard or your house that your dogs can't get access to them, and your cats. Every now and then we do see cats that have eaten these things as well. And if you have a problem, get onto your vet straight away. The quicker we deal with these issues, the quicker we make them vomit, the more chance you have of your pets not getting unwell, or at least if they do get unwell, we can treat it and we can get them through it. It's a bit of a doom and gloom one today, but just be aware. Okay, see you next week. Thanks.